Do you suffer with irritable bowel syndrome? IBS is a common digestive complaint that affects many people worldwide. It can affect people for days, months and years at a time, but also symptoms do typically come and go and is typically managed medically and also via diet. But what about an osteopathic approach to helping people manage with these aches and pains? I treat many patients for other complaints such as back pain and neck pain, but they also do have IBS. So I thought I'd just give you a little bit of a rundown of how I help patients with IBS, and you can discover how an osteopathic approach may help you in the management of IBS as well. My name is Tom Smith and I'm an osteopath and naturopath based here in Riccall, just in between York and Selby. IBS, as we know, can cause symptoms such as cramping that can happen after eating a meal. It can also lead to things like bloating, diarrhea, constipation, feeling tired, but it can also lead to things such as backache, nausea, sickness. The usual port of call is seeing your pharmacist or your GP that may give you medication to help with diarrhea, constipation, and also stomach pain. Keeping a food diary is also really important to understand the triggers to your IBS. And a dietitian may also suggest that you go on a low FODMAP diet, which can be the elimination of certain fruits, dairy-based products, and also wheat-based products. These are some really easy things that you can do at home. But what if those things haven't helped and you may need an alternative approach to help you in the management of these symptoms? Now, the goal of an osteopath is to help calm down the nervous system, improve lymphatic drainage, and also remove any facilitation of any segments in the spine that may be feeding into the organs itself. Now, as we know, the enteric nervous system, which is your second brain or your gut-brain axis, provides a baseline peristalsis action and also modulates the sphincter tone in your organs. Activity of the organs itself is regulated by the autonomic nervous system, which is the sympathetic nervous system, which is your fight, flight or freeze response, and also your parasympathetic nervous system, which is the opposite part of that, which is your rest and digest part of your nervous system. And as I said, the goal of the osteopath is to calm down that sympathetic nervous system. We can do that via improving the parasympathetic nervous system. We could do that via improving function and treating of the ribs, any facilitated segments in the spine, muscle spasm, tension. We can do that via rib raising or articulation. We can do that via improving function of the spine itself. The autonomic nervous system is really quite complex, and we know that its segments from T6 to T9 innervate the organs such as the esophagus, we've got the stomach, the gallbladder, the liver, the small intestine, and we know that from segments from T10 all the way down to L2 innervates the large intestine. So we've got the colon, all parts of the colon. So you've got the ascending, transverse colon, and then the descending colon itself. If we want to improve the parasympathetic part of your nervous system, we can do that via the sacroiliac joints, which is in your pelvis. We can do that by decompressing the sacrum. We can also do that from a cranial perspective. We can also do that by improving and releasing the tensions around the base of your skull, so the suboccipital muscles, the occiput itself, the C1, C2, all help with that axis and tensions around the base of the skull, the jaw. If we're looking at it from a cranial perspective as well, we might want to consider seeing the function of the occipital mastoid suture. We can do that via testing and also release from a cranial perspective. From a lymphatic perspective, which is really important for the osteopath, those of you that are familiar with the lymphatic system, you've got lymphatic nodes which reside around the muscles of the neck, the armpit, We've got them that heavily reside in around the organs itself. So certain mesenteric lifts and certain other techniques to release the diaphragm, the thoracic inlet, the pelvic diaphragm, all can be helpful in that pumping mechanism to facilitate drainage of the lymphatic system. So in cases where there's inflammation or lots of congestion around the organs, helping improve lymphatic flow can be really helpful in those with IBS-like symptoms. And as I've said before, if we want to remove any irritation to the parasympathetic nervous system, we can do that via the sacroiliac joint and the sacrum itself. So these are some considerations from the osteopath. Not saying that these osteopathic techniques can treat or cure your IBS or any other gastrointestinal disorder for that matter, but it may be helpful in the co-management of IBS. If you're already seeing a gastroenterologist, or you're seeing your GP, or you're seeing a dietitian, consider an osteopathic approach in the management of this. If you find this may be beneficial to you, you can get in touch and discuss your case with me in more detail, or you can book online at www.evolveosteopathy.co.uk. And I'm based here at Riccall Regen Centre, just in between York and Selby. Any questions, get in touch and I'll speak to you soon. Many thanks.